Good evening, everyone. I'm Dr. Dhauna Karam, and thank you everyone for coming today. So today I'll be talking about the pathway to do like medical practice in United States, and discuss about like the kind of the pathway I took and my journey as well. So I'm sure many of you here are here today because you would have the American dream. For me, it started when I saw the movie Jeans, and there was some audio in this. It's not coming. That's okay. So it kind of started for me with the movie Jeans. Then maybe many of you would have also watched Sarkar, the song in Las Vegas, where they show, and it kind of gives that big feel of being in a better country, right? And so that might have sparked many of your interest today, and I guess that's why you're here today. So we'll see how we can make that possible. So, of course, US, yes, it's kind of the ultimate destination for everything in the world. There's a religion and caste-free society. It's a very, like a pollution-free world. There is minimal to little political intervention in your practice. Most people are law-abiding, and most things are by the rule. There's a proper tax structure. And for physicians especially, we have like very good pay, like even the basic pay for a physician is like very high when compared to India, and a very good lifestyle. And if you're like someone like me who's very on top, like you don't want like a lot of drama, you want to like be on time and everything, it's a very good country to be in. Of course, India is great as well because it's the fastest developing country in the world. We have like very good education system here, especially our pathology is wide, and our treatment and our investigative facilities are growing in a much faster fashion. But there are some things in India that complicate the life of a doctor, right? There is still some community and religion-oriented practice prevailing. There's like corporate dominance. There's some low payment for skilled people. When you finish MBBS and you go and join as a duty doctor, your payment is low, and then you have to kind of get into that spectrum to get paid more. And as the speaker before me was saying, like before you start your career itself, you're already 30 years, and then you have a family, and then you're getting paid low, and then you have to slowly improve your income. There's still a lot of political intervention. Pollution is a concern. Our tax system, our tax is very high, but our laws are still little weak. So those are all some of the concerns in India, and especially if those are, you feel those are like a big concern and a big headache, I think like taking USMLE and considering a career in US might be for you. But some of the hurdles we have is like many of us, I did my medical school and medical college too. I had no idea about USMLE. Like students in Madras Medical College, they usually used to take their step 1 and step 2 when they're doing MBBS itself. But in my class, no one knew about USMLE, and we didn't know about like the expenses and also like fear of going abroad, right? Especially I was a girl child, so they're like, no, you can't go abroad on your own and everything. So all that are some of the hurdles to go there. And like obviously you're worried about like, hey, if you go and practice there, will you have like a lot of medical legal problems which can complicate like your practice. So, but one advantage for most of the people who are here is like we are Madurai medicals, right? Our college is one of the best college in India, and I mean to get into this itself, you guys have like scored really high. You would have scored even higher in NEET and everything, right? So we are all like pretty smart, I think. So I think we have a good a good recognition in US because they're always looking for skilled people to come there and work for them. And one thing I jokingly share with my colleagues there in US is like, if you're doing a posting in Madurai Medical College, you go to a breast clinic, you can see from stage 1, you can see all the way to stage 4, you can see a fungating tumor all on the same day. So like the amount of clinical expertise and practice we get from our college and Government Rajaji Hospital is just amazing, and that does make us really unique when you're considering a career in US. So as I was mentioning, more than 40% of people, it actually might be more now, right? The health professional in US are Indians, and not only health professionals, right? Look at all the CEOs. Sundar Pichai is from India, and I'll proudly say they're all mostly from South India too, from especially Tamil Nadu. So We do, like US really looks for meritorious people, and especially for us, we have a very good opportunity, and we'll get a lot of recognition there. There are a lot of Indians already practicing this, so it's not like such a novelty anymore. So you will have some Indian in most of the hospitals to help you. So I just put this chart here just to show how the process is different between the American system and the Indian system. So in India, we all go to school, right? After high school, you take your exam, you go into medical college, medical school, and then again you do a post-graduation, and then you do your super specialty. The top one I showed the US system, right? So they go into school first. They go into school first. After that, they do something called pre-med, which is 4 years. And after that, they take an exam to get into medical school. And then they take exams to get into residency, which is kind of our post-graduation here. And then they do fellowship, which is kind of like our super specialty here. So one advantage of us is like we, from high school, we directly go into medical school, right? So if you pursue USMLE, you are actually like going to be one of the youngest doctors there too. So that's another advantage when you go there from here. Because someone doing in America, they are like doing 4 years of pre-med and then going into medical school. And this pre-med and everything, medical school is very expensive in US. In India, it's pretty affordable, especially in a government college. So we have that added advantage. So after you finish, or when you're doing your medical school, you can take the US exam. So you can go and pursue your residency there. You don't necessarily have to do post-graduation here, but some people do that. But you, like, if you go from your medical school and do residency, you have a lot more options to go into advanced fellowships and everything, because you're way younger and you don't have any loans coming from India, because our government medical colleges are pretty affordable here. So this is like the total thing I'll be talking today, right? What do you need to apply for a residency, which is like a post-graduation in United States? So these are all couple of organizations, exams that I'll be talking to, and each of this I'll be going in a little bit of a detail, so you have a good overview of the whole process. So the first organization that you need to know is called the ECFMG, which basically stands for the Educational Commission for Foreign Medical Graduates. So imagine US, right? So this is, the US is kind of a destination for many people coming from different countries, right? So we are from India, there are people coming from Nepal, people coming from Australia. So this organization, what is the role of this, is to say that, hey, this guy is from this country and he is in an accredited medical school. And for people from Madurai Medical College, our college is already accredited with the ECFMG, so you don't have to do anything else. They know that this is a government institution and it's a valid medical college. All you have to do is, there is a form which basically is called a form 186 that you fill, and basically you submit that to the ECFMG. It has the dean's sign in it, and it's like the first step of your USMLE journey. And as I said, why you have to do this is like there are so many people from so many countries applying for US, right? So the role of this organization is to say that, hey, this is a valid medical school in an international country, and this person is going to be pursuing USMLE. So this is like the kind of like the entry point for you. So this the ECFMG is like a website. I have all the links in my slides as well, which I'll share with you. So in this, you first create an account and get that form signed from your dean and submit it. So that's like the first step of your entry into the US medical system. And then the USMLE, which basically stands for US Medical Licensing Exam, and the usmle.org is the website for it, is the exams that you need to take like during or after your medical school to go and pursue a residency or a post-graduation in United States. So the USMLE is not something only we take, right? Anyone who is studying in a US medical school also takes this exam. So it's a common exam for everyone. So it's not just what we take. It's a common exam for everyone. The ECFMG is the one additional step that we do as international medical graduates. And then all of us take the USMLE. So the USMLE has basically 3 steps. The step 1 is kind of your basic sciences courses, like starting from your anatomy, physiology, pharmacology. biochemistry, it also has biostatistics. And the step 2 is more like your clinical subjects, your medicine, surgery, OB-GYN, psychiatry. It also talks about legal, ethical issues and patient safety. And finally, you have the step 3, which is again a part of your clinical subjects, but little more advanced, where they focus more on management aspects. Step 2 is more like the investigatory aspects of your clinical subjects. So one thing we all need to keep in mind is COVID, right? With COVID, there's been a lot of changes. Previously, the step 2 was 2 parts. You take an exam and then you do a practical exam where you come in US and you like see patients, like mock patients, and do like an interview type exam. But because of COVID, they basically abolished that, and they just have that step 1, step 2, which are all like written MCQ type exams, and they have step 3. So COVID is something which is like changing the world on an active basis, and it's something we're going to be living with in the near future. So it's important that always check that usmle.org, right, for any updates. And again, US is a country where they're going to be very clear with any changes. It's all going to be posted. They're not going to hit you with changes without like telling you. So it's important that you check online and keep in mind, because COVID is still making a lot of changes in the exams and the process. So a little bit more about the step 1 of the USMLE, right? So I said step 1 is more your basic sciences, right? You can take step 1 when you're in your first or your second year of your medical school, or you can always take when you're doing your CRRI, your house agency, or at a later point too. I said it's easier to take it in your first or second year of medical school because our subjects match the questions in step 1, because it's basically your first and second year subjects: anatomy, physiology, biochem, microbiology, and statistics and things like that. So it has around 280 MCQs. It's a 1-day 8-hour exam, and it has 7 sessions of 40 questions each, and then you have an hour of break. These are some of the books that you use for most of the USMLE preparation. And especially for step 1, there's a book called Goljan Pathology, which kind of gives like the basic of all the pathology and everything, and it's a good place to start. And then I personally used Kaplan books and video series. I did not join the course, but I got the materials online and I did that. And then there's another series called Master the Boards, which is a good one to use as well. And First Aid is a book that kind of is like a concise version of all the USMLE subjects. It's like a good thing to revise before you go to the exam. And my holy grail, I would say, is the UWorld questions. So UWorld questions is like a question bank, and usually it costs around like $300 or so for a 3-month period. And it basically, you do the questions, and it kind of, it's like practice questions, and it helps you practice. Don't use UWorld as like a mock exam, just use it as a study material. So you do the questions. If you get it wrong, you read the explanation. So it kind of prepares you like to think like how they ask exams in USMLE, right? Because as students studying in India, we are very smart, but our thing is like we have to change our thinking little bit to like fit the American system. So UWorld helps in that thought process change, because when you're working in a government setting, let's say you see a patient with a murmur, right? You like do more of clinical diagnosis. You wouldn't like, you look for a thrill and you'll like grade the murmur, but in US maybe they'll just go ahead and get an echo to confirm it, right? So those are all like little differences between working in a government setting and going and practice in the US. So the UWorld will make you like think like in the little bit in the American like in the American system, and it'll help you get prepared for the exam. So the USMLE step 1 is an exam that you can take in India itself. You don't have to travel to the US for this exam, and it can be scheduled year around. It's just an MCQ based exam. Usually you can take up to 3 to 6 months to prepare it if you're preparing full time, but if you're doing CRRI and preparing, you might have to take a little longer. And again, like you can take it in the first, second or third year of your MBBS, because you'll be fresh and you would have learned the subjects for your exams. And try to score, actually the score is gone now, like it's only the reporting is just like a pass or fail reporting now. That's again a change because of COVID. And I was just checking in the Prometric Test Center the other day, and because of COVID, they didn't have any dates at least in the next 3 to 6 months or so. So if you're planning to take the exam, I would encourage you to constantly keep checking that Prometric website, which is the place where you schedule your USMLE Step 1. Even if you're thinking about taking the exam next year, look for it now, because of COVID, there is a lot of delay in all of these processes. Then coming to the Step 2, it's again a MCQ based exam. It's a 1-day, 9-hour exam. There is 8 sessions of 40 questions each, and you have an hour break. Around 318 MCQs. I pretty much use the same things that I use for Step 1, like Kaplan, Master the Board series, First Aid, and UWorld questions. I'm again saying UWorld questions really help you with the USMLE exam. And you can again schedule it in India using the Prometric Center, and it can be scheduled year around. You don't have to travel to the US for it. And around 3 to 6 months preparation time. CRRI is the best time to target, and again there's no score now, there's just pass or fail reporting. Finally, Step 3. So anyone who's planning to apply for a residency in US, you only have to take the Step 1 and Step 2. You don't have to take the Step 3, because Step 3 is only needed when you're doing a post-graduation and then to become a licensed medical practitioner in the US. I took my Step 3 before residency, just because taking your Step 3 and having it done kind of gives you an edge when you're applying to interviews or when you're applying to residency. But this is not a requirement, so you don't have to take the Step 3 before applying for your residency. Step 3 is actually, it has 2 days, and day 1 again it's an MCQ based exam. It's a 7-hour exam, and it has 6 sessions of 38 to 40 questions. And then day 2 is 180 MCQ 9-hour exams, and it has 6 sessions of 30 questions. And day 2 has something unique called case simulation. It's again all online. You won't see a patient, but the case simulation will be like, it'll say like Mr. X walked into the room and he comes in with like blood pressure of so and so, heart rate of so and so. What will you do? So it basically puts you in a clinical encounter, and it walks you through, and at the end of it, it will either say your patient lived or patient died, and of course if you say more patients, you're going to pass the exam. And similar study materials with the Kaplan, First Aid, and the UWorld questions definitely help. And UWorld also has a series for the case simulation, so you can practice it beforehand before you go and take the exam. And you can take it in a Prometric Center. It can be scheduled year around. You don't have to take day 1 and day 2 simultaneously. You can split them and take as well for Step 2, Step 3. And if you have prepared for Step 1, Step 2, and you're taking Step 3 like within, like simultaneously within like 3 to 6 months, you just need 1 to 3 months to prepare for Step 3, because Step 3 is like a extension of Step 2. You've already read about the diagnosis and investigations, right? Step 3 is more the management aspect of your clinical sciences, medicine, surgery, and OB-GYN. So it's very easy if you take it right after your Step 2, it's very easy for you to crack Step 3. Just a recap of the resources. So the usmle.org is the site where you go and like you look up the exams, and always keep checking that, because of COVID there's like all changes happening. And some of the books that I used are Kaplan and Master the Board series. I used First Aid books and UWorld questions. I have something called NBME here. NBME stands for, it's just like a board, it's like a preparatory exam, so people pay for it, and usually it's around like $100 to $200, and it's like a mock USMLE exam. So NBME is more like, let's say you're prepared for USMLE for 6 months, and then you're like, hey, will I pass or not pass? Can I take a mock exam? You take the like a mock exam through NBME, which will be very similar to USMLE. It will be an 8-hour exam with questions and everything, and you can see what your score is, so you can decide like, hey, can I take it, or if I need some more preparation before I take the USMLE. So that's another resource to know. So you take your steps, right? What is another thing that you need to build your profile is doing observerships and externships in US. So as I mentioned previously, there are people from all the countries applying to get into US, right? So so let's say a hospital, like the hospital where I did residency, Chicago Medical School, has 10 residency spots, and for 10 they get around 4,000 applications or so. How are they going to review the 4,000 applications, right? So how do we stand out, right? So that's where doing observerships and externships come into play. So I put a link here, but even if you just Google like observership programs in the US, you will find like a lot of opportunities where what an observership means is like you're just being like you're just shadowing a doctor in the US. You're just being like a volunteer. You're working with them, and then you like go to rounds with them and you work with them so that they'll know you, right? So when the rounds, when they're discussing something, if you're answering and everything, you can get a good impression with them. And ultimate goal is to get their recommendation and maybe get letters from them so you can use it in your application. The difference between observerships and externship is observership is you do after your medical school and you're just a volunteer. You can't really touch the patient or do any procedure. You just observe everything and that's it. Externship is something that you do in your CRRA period and you have to get special approvals for that, but you can be like a student. You can go and do some procedures, you can examine the patient and present those kind of things. Externship is more preferred, but of course with COVID, most hospitals are not allowing it these days and they're doing something called virtual observerships. Again, like if you ask me, is the virtual observership good? Something is better than nothing, right? Having some form of US clinical experience and having a US doctor vouch for you will definitely make a difference in your application. So remember I told you about the ECFMG, the Educational Commission for Foreign Medical Graduate. So first you register with them and they said, right, hey, this is a student who is in an international school and he or she is applying for a residency. So then you take your steps. You take your step 1, step 2 of the USMLE and you have already given that form 186, which is like a dean signed form that you submit to the ECFMG. And finally, recently in the last 2 years, they have added this OET exam as a requirement for the ECFMG certificate. The OET exam just stands for an English exam. That's like your TOEFL. It just kind of tests your proficiency in English. And once you have your step 1, step 2 pass, and you have the form 186 signed and you pass the OET exam, you get something called a ECFMG certificate. The ECFMG certificate is just a document which tells that, hey, this candidate is from, let's say, India, but he or she has completed the necessary steps to get into a residency into US. And the people who are doing medical school in US also do the same things, but they do their step 1 and step 2. They don't have to do the form 186 and OET exam. But the ECFMG certificate is what makes an international graduate ready to apply for residency in par to an American graduate. And these are all the things you need for the ECFMG certificate: a pass score in step 1, step 2, and a pass in your English exam. Then you're applying for residency, and how do you apply for residency? Like here you get a rank in NEET, right? And based on your rank you choose your college. In US the system is little bit different. We have an organization called ERAS, which stands for Electronic Residency Application System. And in this ERAS site you kind of create a profile for you and you upload certain things, and based on that you send your application to different residency programs. So in the ERAS website, when you open, you create something called a AAMC ID, which is called as just like a American Association of Medical Colleges ID. You just like put an email ID and a password and you can get that. And then you upload your medical school transcripts. Your medical school transcripts are basically like your score reports that you get from the college. So usually when I was there, university will give you the scorecards, right? Then we need to get that, and there is a person in the office who will change it into like a USMLE format. I hope the process is improved now because more people are going for USMLE. It will just be in a specific format and it's just your scorecard from your first year and your second year, and you submit that to ERAS. Then another thing that you submit is called a MSPE, which is called like a dean's evaluation. It's called like a medical school performance evaluation, which is basically our dean writes a letter about you, says like, hey, you're a good candidate and you've completed the residence, like the core subjects in step 1 and step 2, no behavioral or disciplinary actions pending against you. It's a certified document from our dean that needs to get uploaded as well. Then you upload something called the LORs, right? That's the letter of recommendation. So usually you can upload anywhere between 3 to 4 LORs, and again that is something you check before every application. They keep changing it at times, and usually you can target for at least 3 letters of recommendation. And then finally you upload your resume or your curriculum vitae, and this forms like a complete ERAS application. So this is the website for ERAS, the residency matching service, and you basically go into sign into my ERAS and create that AAMC ID. And the medical school transcripts are something you obtain from the college administration. One thing the transcript must have is it should have subject-wise details. It should have hours of instruction for each subject and who your supervisor was for basic science and clinical clerkship. And it also has your marks, and it also has a certificate of internship if you're applying it in your after your CRRA period, of course. And it has the dean's signature, and it needs to have the official seal. That's the complete format for the medical school transcript. And if you're someone like me, my name is actually Dhauna K in India, and when I went to US it got translated to Dhauna Karam MD because my entire dad's name got added. So I needed to get a special letter from the dean saying that Dhauna K and Dhauna Karam MD are the same people. So that's something you need to get, and you might have to submit it with your application. And the MSP, as I was mentioning, it's a dean's letter. It has some unique characteristics about you, your academic history and progress, and mainly it should contain no disciplinary actions and things like that. Because imagine there's so many people applying to US, right? They don't want to take someone who's trying to escape from one country or anything. So those are all things that will be in your MSP. And again, anything they need a dean sign with the official seal, and that's very important. That makes the document really credible. And then the other thing you upload is your resume, right, and your curriculum vitae. So this is something that you create in ERAS itself. You enter your personal information, you enter about your medical education, your memberships in professional societies like the IMA, any certification or licensure that you do, any basic life sciences, ACLS courses, any work, volunteer experience, research experience, publications. You also talk about your language fluency, hobbies and interest. So I wanted to go a little bit on detail in the resume because, as I said, for 10 spots there's almost 4,000 applications, so it's almost 1 in 100, 1 in 200 spot, right? So how to make your resume stand out, right? One thing you can do is getting memberships in professional societies, right? Join IMA and be active, be a volunteer, support your other local organizations. That will make your resume stand out. Second thing is you can do certification or licensure course. When I was here in my CRRI, as Dr. Amanullah was mentioning, they had a certification in oncology course which I attended, and that basically stands out in my resume, and especially I'm going into oncology now, so that definitely stands out. And anything you do as volunteer, right, and especially when we are from India, we are always told to be very humble and downplay our things, right? We might have been a part of the college exhibition and everything, and we would have totally forgotten about this. But these are all things that really stand out and make your application really stand out in the US, right? So when I was here in my third year, we organized a Madurai Medical College exhibition, and that's something that I spoke about in my volunteer experience, how we had different stalls and how we created a whole village, and we had a lot of public come for that. And in your work experience, you can talk, if you're able to do some observerships or externships in the US, you can talk about that. If you had done a post-graduation in India, right, then you can talk about that in your current and prior training, be it an MD or a diploma. And you can definitely talk about your research experience and publications. And if you have your step 3, that again makes your resume stand out. So research and publications, right, that is something area where most Indian candidates lag, and I was also, I was not a big researcher or anything because we're more clinical oriented, right? We have when you're working in a medicine ward, you have 100 plus patients, so how can you go and do research, right? You'll just be so busy with it, and we are all thinking more clinically, and research is something that we don't focus on. But there are some simple tips that I wanted to share, right? So as I was mentioning, we have a lot of pathology. So any like fungating tumor or any like late presenting disease or anything that you're doing a different treatment, right? You can write it as a case report. Or another thing we have advantage is like we are working in resource limited settings, right? So let's say there is a patient who comes in and then you're managing it with limited resources. You can build a case report out of that. You can say like, hey, this patient came in and we didn't have, when I was working in GRH, sometimes we don't even have gloves and everything, and we like did makeshift paper gloves and things like that. So those are all things that will be really appreciated in US, right? Because they have like so much resources there. So when you're presenting something like, hey, we are coming from a resource limited setting and we did all this, that is something that you can write as a case report or even make it into an abstract. Review articles are pretty easy. Now we have things like PubMed, which is like a database research, Embase and Cochrane, which are all like data. They have like so many research papers in one place, right? So you can do a PubMed search and do a literature review and present. Another thing you can do is like chart reviews. The charting system sometimes might not be great in our GRH, but if you're able to like find a department with like good retrospective charting and everything, you can do like some chart reviews. You can take, let's say, 100 patients with anemia and see what is the most common etiology or presentation and things like that. When I was doing my medical school, I basically did a survey study because in our OG department we have like every day OP, we get like 100, 150 OPs and everything, right? So I basically did a survey study on the knowledge of contraception in women. My second sister, she's a OG, she kind of helped me do that. And so that was pretty easy because in one day I could go and I was able to like survey 300 women there in the OG wards. So those are all some things you can just do in one day and create an abstract and present. Of course, if you're able to involve in clinical studies and prospective studies, it will be great, but sometimes it will be harder for us working in government colleges. But those are all options that you can definitely try and get published as well. And again, don't always try to get a publication, right? Publication sometimes takes time. So even if you present in local conferences like IMA, ICMR conference comes and local physician group conferences come. So if you present in all those also, it is a big thing, right? You're presenting an abstract and your abstract comes in their book. So you can use all of that in your resume. And of course, if you can get a publication, that's great. And that will also add up to your profile. So one thing in research I wanted to highlight is like when you're trying to do something on your own, it might be hard. So try to find a mentor who will guide you through the research process. And previously it was very hard to find mentors, but now even in the government system, the promotions are being based on like publications and research, right? So there are a lot of people who are like doing research or like they want to do research, right? So find a mentor and work with them, an assistant or associate professor or a chief. If someone is active in research, find them and work with them. And then always make sure you get appropriate consent, be it even a case report. Each journal, like BMJ case report is a journal which publishes good case reports. They have their own consent form. Make sure you print it and have it in your pocket. Whenever you see a patient, get signed from them if you're thinking even to write about that patient at a later date. Because consent and getting like, or you're creating a retrospective chart review, make sure you talk to the Madurai Medical College IRB, like the Institutional Research Review Board, and get their approvals. Because any research without appropriate consent or IRB approvals will be viewed very negatively. So get that and find a mentor, and that will really help in doing research. And the other thing in the ERAS is something called a statement of purpose, which is basically like you just write a story about yourself. You just talk about why you choose medicine, what you want to do. Please do not copy SOPs from the internet. You have like free plagiarism check softwares that you can run and see if you actually have mistakenly copied it from internet. So SOP is something like when people ask you to talk about your story, you will be like, so my story was like, hey, my dad told me to study well and all my sisters were doctors, so I got into medical school. But that doesn't work, right? You have to create something. So first write a copy, and like I started like when I was like a kid, I had a doll and I was taking care of the doll and I felt like a pull towards medicine or something like that, I started writing. So one thing I would say is like write a SOP and then in like a week or so read it again. Then you'll feel like you'll get some more ideas and then you can improve. So don't like write a SOP and submit right away. Write it and review it at least like 5-6 times so it becomes a believable story and then you submit it. And finally, the letters of recommendation, right? So 3 letters are required, but again with COVID, just make sure that's the requirement. So who are some candidates who you can get the letter of recommendation? One, you can get from your home institution attendings and HODs, right? Those letters carry good value. But ultimately try to get some from US attendings. So that's where your observerships and externships come into play. When you're working with someone, they see your work, they are impressed with you, they're going to write you a good LOR. And that really, really helps. So definitely try to get that. Even if it's a virtual observership, if you're like attentive and you are like actively participating, you are having a higher chance of getting a good LOR from a US attending. So just to recap, right, so we talked about the ECFMG where you create an account and it's like the first step in your USMLE journey. We talked about your USMLE exams which you take, the step 1, step 2 and the step 3 which is optional. We talked about the US clinical experience in terms of observerships, externships and volunteering. And we talked about getting that ECFMG certificate, right, before applying to residency. And for the ECFMG certificate, you need your step 1, step 2, and you need also your English exam. And the ERAS is the residency application service where you create an account, you upload your medical school transcripts, your dean's letter, you write your statement of purpose, your resume, you upload your letters of recommendation, and that completes your ERAS profile. And after that, in ERAS, you apply for the programs and you participate in something called the match. So how do you shortlist programs, right? There are a lot of blogs and there are even Facebook groups and everything where you can join with other people who are preparing for USMLE at a time. And especially, let's say if you're interested in a specific specialty like pediatrics, internal medicine, there'll be specific groups for that. And so you first see like which are the colleges offering your specialty. And then some people might have a location preference, right? You might have a family member or someone there. So look the location. Other criteria to look for is the IMG friendliness. How will you find the IMG, like International Medical Graduate Friendliness? Is like, let's say if you find a program, you go and look into their website and look the last 2 or 3 years graduates and see where they did their medical school from. If it's like somewhere from India or anything, or even abroad like Nepal or Australia, then you know, okay, this is a program that's taking international medical graduates. And score criteria is not valid anymore because they're just giving pass or fail. See the number of positions, and most programs will have a US clinical experience requirement. They'll say like you need to do at least 6 months of observership before doing residency for us. Just check that and make sure you match that. And last but not the least is a visa, right? So when you're doing residency, commonly you do in a H1 visa, which is a work visa, or a J1 visa, which is like an exchange visitor visa. So make sure like those visas work for you when you're applying for it. And when I said the ERAS application, right, you create the entire profile and you keep it beforehand, and then one day the ERAS opens to apply for programs. That's when you select the medical colleges that you need to apply to, and then you'll get an email saying like you can upload your documents. You upload all the documents and then you can apply. I think it's a lot, right? Everyone is like, okay, stop. We're almost to the end, just a couple more minutes. So finally, after you shortlist and apply to programs, you'll receive a call for interview. So the interview, again, previously we used to travel and you need to go to the college and attend the interview, but now it's all virtual interviews, so you just like attend it in a Zoom setting. And very few interviews they'll ask you medical questions to assess your medical knowledge, because they have your step 1, right, and step 1, step 2. They know that you have knowledge, you're a doctor, you've passed those exams. The interviews will be most like how are you going to be there, how are you going to be a part of the team, how is your emotional intelligence, are you like going to be a good member or are you going to be a problem person. So they'll ask you random questions. Your statement of purpose might be the topic of discussion in the interview, and they'll take that and they'll be asking about that. Or they'll ask you questions like, let's say someone wrote you a good letter of recommendation, they'll start talking about that. So interview is more to assess you as a person and assess your like your EQ quotient. It's not about your IQ at all in most cases. And finally, after you go through the interview and everything, you attend something called NRMP, which stands for National Residency Matching Program, and that's the website for it. And let's say you got like 5 interviews, right? You rank the programs like 1 to 5, and the program, let's say, interviews 40 candidates. They'll rank those 40 candidates in 1 to 40. And this NRMP, this is a organization which will help match the candidate to the residency program. So as I was mentioning, let's say you ranked City Hospital first and City Hospital ranked you second, and they have 2 positions. This person will get into City Hospital. So it kind of keeps working through the list, and it's more applicant friendly. So based on the applicant's preference takes priority over the program's preference. And I'm actually going through this process again now for my fellowship. So this is the same process, and I've done with all my interviews and everything. I've submitted my rank list. I just I'm waiting for the results. So finally, I wanted to talk about the importance of connections, right? So I said, like, if they have 10 spots, they're getting 4,000 applications, right? How are they going to be reviewing all of it, right? So if you know someone who's working there, or like someone like your senior or someone, you can obviously talk to them and have them put a word for you, which is definitely going to help for them to at least take your application and start reviewing it. And one thing I wanted to say about connections is, like, now I'm giving this talk, right? So I'm seeing all of you. Like, if you ask me to recommend, I will, but let's say if I have worked with you and I really know you as a doctor who works really well, my recommendation will be more stronger, right? So try to find someone like that, like who really knows you and worked with you and who can put in a strong word for you, rather than me saying like, hey, this is a candidate from my same medical school, right? So try to form that connection with someone who you're working with. And let's say if there's no one in your class or your seniors who's applying, that's okay. You try to work with someone in US, so they actually see your work and put a word in for you that carries more weight and more strength, I would say. And finally, you get that you have matched email, and that's a time to relax. I'm actually waiting for that email for my fellowship, so hopefully it'll go through. And once you match, there are certain things. You kind of get connected to the program coordinator, and visa takes priority then, right? You need to decide if you're doing if the program is doing J1 or H1B for you. And now with all the delay in the embassy and everything, those are all some things that is complicating things. But of course, if you have a residency spot and you're a doctor, they do consider you as a priority. So they'll expedite your visa appointments and everything for you. And then you get like the license of the state that you work in. For that, again, you need your college transcript and your dean's letter. So especially knowing Madurai Medical College, when you're getting the medical transcript, get like 3 or 4 copies, because you need it in every step of the way, and you need originals. You can't use like color copies. So when you're getting it once for all, just get multiple copies. So the cost, right? Everyone is worried about the cost when you're considering USMLE. You have the exam, you have the material fee, then the program application. When you apply for each college, you have to pay a fee in ERAS. And then the interview travel fee, now it's not a concern because it's virtual interviews, but when things change, again, you have to travel. And then the observership cost, when you're staying there, living expense, all that. If you ask me to give me a number, it can cost anywhere around 15 to 20,000 US dollars. So that is something you need to plan for as well. And when you get into residency, in the first year, you'll get around $50,000. That's like a stipend. And like every year, it'll go to like $51,000, $52,000 or so. So that'll be like a stipend fee, but so you'll be able to pay back. So if you can get a student loan or something, you'll be able to pay back within even your first year, because you'll get the stipend. But approximately, I just tried to put all the exam fees, material fees, the mock exam fee and everything, and approximately it came for me around like 15 to 20,000 US dollars. So that's something you need to consider. And as I was mentioning about this stipend, right? So I put internal med, family med, and pediatrics here because that's most commonly what our graduates do. But if you do something like radiology and surgery, the residency length will change. Sometimes it's like 4 years or 5 years as well. And finally, you like to practice, after that 3 or 4 years, you take something called a board exam, and then you become a licensed medical doctor. This is a picture from my graduation, and all your hard work finally pays off, because even the basic, like a doctor who works in, like a general medical doctor, right, like who works as a duty doctor, can earn anywhere around $200,000 in US. So that's like the basic salary. So now I'm at Mayo Clinic with God's and everyone's grace. It's a really good hospital. It's one of the top rated companies to work at. And the take home message is try to build your research profile. Try to make a lot of connections, and especially connections with people that you work with, and you need a lot of patience and perseverance to achieve this. I'll take any questions. No one has any questions? Otherwise, I'd just like to thank my dad, who really pushed me to give this talk. And also my husband, who's holding the fort with my 2 kids when I'm here. And my sisters, who took the time off their busy schedules to come here and gather students. And my mom too, who's always supporting me. Thank you very much.